Zinc has so many health benefits it's almost impossible to cover all of them. The mineral has potent antioxidant and anti-inflammatory effects. It's essential for immunity, reproduction, mental health, skin health, cognitive function, and much more. Zinc is an essential mineral found in all organs, tissues, and fluids in the body. As the second most abundant trace mineral in the body after iron, it plays a pivotal role in a variety of biological processes. It's required for the catalytic activity of more than 300 enzymes involved in the synthesis and the metabolism of carbohydrates, fats, proteins, nucleic acid, and other nutrients. It also plays a role in stabilizing cell and organ structure, immune function, wound healing, cell division, growth, blood clotting, thyroid function, vision, taste, smell, and more. Despite having such critical functions, it's not stored in the body and it's required regularly through the diet. Zinc is more easily absorbed from meat and animal proteins. Vegetables are not ideal sources because they contain phytate, a compound in plants that prevents zinc from being absorbed. Because it plays a critical role in the immune system, a zinc deficiency contributes significantly to the global burden of disease, making it a major public health issue. Groups that are at risk of a deficiency include people with digestive disorders, vegetarians, pregnant and lactating women, alcoholics, and people with sickle cell disease. Oral or intravenous zinc supplements can prevent and treat a zinc deficiency of different origins. Cases that may require a prompt intervention can include severe diarrhea, malabsorption, liver cirrhosis, alcoholism, and renal failure. Many studies show when infants and children in developing countries have zinc administered, it reduces the duration, the severity, and the incidence of acute and chronic diarrhea. Zinc supplementation is likely effective in treating Wilson's disease, a disorder where copper accumulates in the tissues. It blocks copper absorption and it increases copper elimination in the stool. Zinc acetate is an FDA-approved drug for Wilson's disease. People with acrodermatitis enteropathica, a genetic disorder affecting zinc absorption, can experience skin irritation, hair loss, diarrhea, and high rates of infection. Zinc supplementation in therapeutic doses usually results in a complete recovery. Studies have shown that zinc levels are often low in people with atherosclerosis or hardening of the arteries, heart disease, chest pain, and heart failure. One study found a higher rate of heart failure was associated with zinc deficiency. According to one clinical review, high doses of zinc are able to prevent and to treat angina or chest pain in patients with atherosclerosis. In a meta-analysis of 24 studies and 14,515 participants, zinc supplementation significantly reduced the total cholesterol, the LDL, and the blood lipids. A reduction in these markers may lower the risk of heart disease. Scientists observed the potential of the supplemental zinc to protect the heart from stroke-related injuries in rats and mice. Zinc ions can bind to insulin receptors and activate insulin signaling pathways. By mimicking insulin, zinc reduces excessive insulin secretion by pancreatic cells, and this helps to protect the pancreas tissue from damage. Because of zinc's essential role in processing, storage, and secretion of insulin, a deficiency can lead to increased insulin resistance. Studies have found pre-diabetic and diabetic patients were more likely to be zinc deficient. Studies in women report that higher dietary zinc intake can reduce the risk of developing type 2 diabetes. A meta-analysis of 22 clinical trials confirmed significant benefits of zinc supplementation for blood sugar control and insulin function. Zinc may also decrease the severity of diabetic neuropathy, or nerve pain, oxidative stress, and cholesterol to triglyceride level in type 2 diabetic patients. Zinc, both oral and topical, can benefit a variety of skin conditions, like acne, warts, rosacea, eczema, psoriasis, melasma, and dandruff. In people with acne vulgaris, zinc supplemented groups, orally, showed a significant improvement in the symptoms when compared with placebo groups. Clinical trials in patients with viral warts resulted in complete clearance of the warts for the majority of the zinc-treated individuals, both orally and topically. It also has a similar effect on treating herpes. A study in people with rosacea showed that the oral zinc was able to reduce disease symptoms. Zinc supplementation exhibits similar efficacy in treating other inflammatory skin disorders like psoriasis and eczema, likely owing to zinc's anti-inflammatory and antioxidant properties. However, the results are less convincing. Zinc may also treat seborrheic dermatitis or dandruff. Studies show shampoos that contain zinc can significantly reduce the scaling and the inflammation that's associated with dandruff. Zinc also protects against sun damage on the skin, and this can cause skin aging and cancer. A study in humans found a sunscreen that contained zinc was more superior than titanium oxide in providing protection against ultraviolet radiation. In a meta-analysis of 17 trials and 2,400 participants, low blood levels of zinc were associated with more severe depressive symptoms. Dietary intake of zinc was inversely associated with depression rates in another meta-analysis of 9 studies. Zinc supplementation significantly improved the efficacy of standard treatment with antidepressants in 3 trials on 118 patients. When given to 30 young women with impaired mood, zinc significantly reduced anger and symptoms of depression. A study found zinc therapy was able to improve the overall mood in 46 overweight subjects, likely by increasing brain-derived neurotropic factor levels. One of the earliest signs of a zinc deficiency is a loss of appetite. Clinical studies in patients with anorexia nervosa show a significant association between the disease and low blood zinc levels. Many trials with oral zinc supplementation report an increase in weight gain, muscle mass, appetite, taste sensitivity, and food intake in anorexia patients. In one study on rats, zinc supplementation was able to rapidly stimulate food intake by increasing orexin and neuropeptide Y. Zinc is essential for the normal development and the function of many immune cells. Because of the critical role that it plays in the immune system, even a mild deficiency can impair the immune function, and it can increase the risk of bacterial, viral, and parasitic infection. In clinical states associated with immunodeficiency and in the elderly, zinc supplementation can restore natural killer cell activity, lymphocyte production, and resistance to infections. Studies in HIV patients with low blood zinc levels reveal that chronic supplementation is associated with lower opportunistic infections and a reduced risk of immunological failure. However, supplementation must be exercised with caution, as excessive zinc can worsen disease symptoms. In malnourished infants and children in developing countries, zinc administration reduced the duration, severity, and the incidence of diarrhea, respiratory infections, and malaria. Similar beneficial effects were reported for other infectious diseases in humans, including shigellosis, leprosy, tuberculosis, leishmaniasis, hepatitis C, and the common cold. On the other hand, excessive levels may suppress immunity. A study in healthy men revealed high doses of zinc reduced several immune functions, including the activation of lymphocytes and phagocytosis and neutrophils. Owing to its immune-boosting properties, zinc is among the most popular supplements for the common cold. Indeed, most clinical trials and reviews show a significant decrease in the duration and the symptoms in adults. Zinc gluconate or zinc acetate supplements with 9 to 24 milligrams of elemental zinc per dose have shown the best results when initiated within the first 24 hours. However, the research is less convincing when it comes to using zinc for common cold prevention. According to a study on 48 children, low serum zinc levels can be associated with symptoms of ADHD. In a trial of 400 children with ADHD, zinc supplementation was significantly superior to a placebo in reducing the symptoms of hyperactivity, impulsivity, and impaired socialization. In combination with standard treatment, zinc supplementation reduced hyperactivity and impulsivity in 44 children with ADHD. It was particularly effective in obese children with a zinc deficiency. The potential benefits for children with adequate zinc status is less clear. Age-related macular degeneration, a major eyesight issue in the elderly, is believed to be caused by oxidative stress. Clinical studies have found zinc supplementation can slow the progression of the disease, possibly by preventing the oxidative damage to the retina. Most studies use zinc in combination with other antioxidants like vitamin C and vitamin E, which likely contributed to the results. Preliminary research suggests that zinc may protect against diabetic retinopathy. This is because of zinc's ability to reduce oxidative stress and inflammation. Night blindness is one of the earliest symptoms of a vitamin A deficiency. A study found zinc was able to enhance the effect of vitamin A in restoring the night vision on pregnant women with low zinc levels. Zinc supplementation was able to enhance cognitive recovery in 26 zinc-deficient stroke survivors. Zinc supplementation resulted in superior neurophysiological performance, particularly attention and reasoning skills, in a study of 372 children. In studies of almost 300 malnourished infants and toddlers, zinc supplementation led to increased activity as well as mental and motor development. On the other hand, zinc supplementation improved growth, but it failed to improve cognition in 16 zinc-deficient children. Maternal zinc supplementation enhanced spatial learning and memory in rats. A study showed zinc supplementation improved symptoms like cough, wheezing, and shortness of breath in children with asthma. Low blood zinc levels can be linked to more severe asthma symptoms in children. Zinc was also able to reduce airway inflammation and oversensitivity in mouse models of allergic inflammation and asthma. In response to grass pollen, zinc increased regulatory T cells, and it decreased proliferation in peripheral blood mononuclear cells isolated from allergic subjects. Zinc deficiency is linked to delayed wound healing in some patients. Adhesive tape with zinc enhanced the repair of skin ulcers in a study on 44 diabetic patients. 2 studies of 58 participants showed that zinc administration, oral or intravenous, can speed up the healing process after surgery or burns. When applied topically, zinc oxide improved wound healing in rats and guinea pigs. Prenatal zinc supplementation in 240 pregnant women from a poor region significantly improved bone development in their babies. In 32 young women with thalassemia, a blood disorder, and 147 girls, zinc supplementation improved bone density. Another study revealed that zinc supplementation increased bone formation markers in healthy men. In lab animals and test tubes, zinc was able to increase bone density and strength by enhancing bone formation and preventing bone loss. In a clinical study of 200 bald men, topical zinc was able to improve hair growth. Additional research suggests that zinc's antimicrobial, anti-inflammatory, and antioxidant effects on the scalp are potentially involved in the increase of the hair density. Another study in women with polycystic ovarian syndrome showed that zinc supplementation had beneficial effects on the number of symptoms, including the alopecia or the hair loss. Zinc treatment also reversed the hair loss in patients who underwent vertical gastroplasty, stomach stapling, a surgical operation that can result in a zinc deficiency. Restoring zinc levels in chronic kidney disease patients on hemodialysis can improve overall kidney function and reduce many complications that are associated with the disease, like heart disease, anemia, infections, and sexual dysfunction. The effects are likely achieved by reducing inflammation, oxidative stress and cholesterol, as well as by enhancing hemoglobin, sex hormones like testosterone and luteinizing hormone, and immune function. Low blood levels of zinc are associated with pregnancy complications like spontaneous abortion, preeclampsia, extended pregnancy, preterm birth, and abnormal fetal development. Studies have shown that maternal zinc supplementation in zinc deficient or underweight women can reduce the risk of preterm birth and protect against fetal damage from alcohol exposure. A study found that Indian mothers receiving supplemental zinc had longer gestational periods and babies with healthier weights. Another study in pregnant women with low blood zinc levels found the zinc supplementation, 25 milligrams per day, during the second half of the pregnancy significantly increased the infant birth weight and the head circumference. It's proposed that these beneficial effects are a result of its ability to inhibit embryonic cell death, to increase growth factors, and to reduce oxidative damage, all of which help to promote healthy fetal development. In a number of studies, zinc supplementation produced significant beneficial effects on both height and weight measured in children, especially in underweight, malnourished children suffering from stunted growth. A dose of 10 milligrams of zinc per day for 24 weeks increased the net growth around 0.37 centimeters in height compared to children treated with the placebo. Maternal and infantile zinc supplementation increased weight and muscle mass in 2 studies in developing countries. Zinc deficiency is associated with hormonal imbalances, and this can lead to ovarian function problems, menstruation irregularities, and infertility. Several studies have found that oral zinc administration was able to reduce the severity and the duration of menstrual pain in women. Studies have also found zinc supplementation in women with polycystic ovary syndrome can reduce insulin levels and improve disease symptoms like body hair growth and balding. Women with endometriosis, a condition where the tissue inside the uterus grows outside of the uterus, exhibit low blood zinc levels. One study reported an intake of antioxidants, vitamin C, vitamin E, selenium, and zinc, was inversely correlated with the severity of endometriosis progression in women, indicating that zinc may slow the development of this disorder. In 60 patients with non-alcoholic liver cirrhosis, supplemental zinc improved the liver function and it prevented excessive copper accumulation, which can damage the liver. It was able to improve liver function based on alkaline phosphatase and bilirubin levels in 30 patients with alcoholic liver cirrhosis. Zinc supplementation in animal models of alcoholic liver disease protected the liver while blocking most mechanisms of liver injury. Zinc improved the outcome of 62 patients with hepatitis C, which, if left untreated, can lead to liver scarring. People with tinnitus or ringing in the ear have lower levels of zinc in the blood. In a trial of 41 participants, zinc supplementation, 50 milligrams per day for 2 months, was able to reduce the severity of the tinnitus in 82% of the patients. In another study, the addition of zinc to oral corticosterone was associated with a greater improvement in symptoms in 66 people with sudden hearing loss for unknown reasons. Otitis media is an infection in the middle ear. The effect of zinc supplementation on this is mixed. The benefits may be limited to malnourished children with a zinc deficiency. A zinc deficiency is linked to impaired hearing in mice and rats. This can be improved with zinc supplementation. This is likely a result of zinc's protective effect against toxins in the ear structure. Zinc deficiency can lead to excessive plaque formation and worsen the inflammatory process in gum disease. Zinc-based mouthwashes were found to be effective in reducing plaque growth. Similarly, a study in children from low-income areas found a daily intake of 15 milligrams of zinc for 10 weeks was associated with reduced plaque formation on the teeth. Zinc-containing toothpaste and mouthwash can help with gingivitis. Bromhidrosis, or body odor, is usually associated with an increased bacterial flora in the armpit region, mainly consisting of Staphylococcus and Corneobacterium species. Because of its antibacterial action, topical zinc has shown efficacy in reducing armpit and foot odor in clinical studies. In 30 Alzheimer's disease patients, zinc supplementation protected against cognitive decline by lowering blood copper levels and by improving zinc nutritional status. According to the authors, copper toxicity can play a role in the development of Alzheimer's. In different animal studies, zinc was neuroprotective in moderate concentrations, and it helped to preserve learning and memory function. In a mouse model of Alzheimer's disease, zinc supplementation reduced pathological factors that were associated with the progression of the disease. It also improved mitochondrial function and brain-derived neurotropic factor levels in the hippocampus. Seminal zinc concentration was positively correlated with sperm count, motility, and viability in different clinical trials. This is likely because of zinc's role in stabilizing the cellular membranes and the DNA by reducing the oxidative damage of the sperm cells and enhancing spermatogenesis, the formation of new sperm cells. In infertile men with low blood testosterone, supplemental zinc led to increase in sperm count, testosterone, DHT, and fertility. Low to moderate doses, 12 to 120 mg per kg of zinc intake, appeared to enhance reproductive function in rats. Zinc is highly concentrated in the prostate and the testes, and it's involved in the synthesis of testosterone. In rats, zinc was able to preserve testicular function, as measured by testicular weight, sperm concentration, and testosterone level, in response to oxidative stress induced by cigarette smoke. One study found blood zinc levels were significantly lower in chronic fatigue syndrome patients, and that symptom severity was negatively correlated with blood zinc levels. The study concluded zinc can be effective in attenuating chronic fatigue syndrome symptoms because of its antioxidant and anti-inflammatory properties. Gut inflammation caused by a leaky gut is common in people with chronic fatigue syndrome. A study found treating leaky gut with a mixture of anti-inflammatory and antioxidant substances, including zinc in chronic fatigue syndrome patients, resulted in significant improvement of their symptoms. Lab studies show that zinc is involved in regulating pro-thrombotic or clot forming and anti-thrombotic or clot preventing factors derived from platelets and the blood vessel lumen. Hyperzincemia, high levels of zinc in the blood, can cause blood clotting, while low levels of zinc in the blood lead to prolonged blood clotting times. Both conditions cause impairments in the platelet aggregation and abnormal bleeding. One study revealed restoring the zinc levels in zinc-deficient men led to normalized platelet aggregation and blood clotting time. A study in obsessive-compulsive disorder patients showed zinc, in addition to fluoxetine or Prozac, was able to reduce the symptoms. Its ability to suppress glutamate release and transmission may have contributed to the improvement. A study in schizophrenic men found that zinc, in combination with risperidone, improved many symptoms associated with the disorder, like aggression, hallucinations, and delusions. This effect is in part attributed to its antioxidant and antidepressant properties. Zinc deficiency has detrimental effects on the gut lining on animal models and humans in a variety of gastrointestinal diseases, like inflammatory bowel disease, diarrhea, cancer, alcohol toxicity, and colitis. In most cases, zinc supplementation can provide improvements. In rats and mice, scientists tested the ability to stabilize the gut mucosa and to reduce injuries by enhancing gut repair process in rats and mice. Zinc also protected the intestinal mucosa from alcohol-induced damage in rats and mice. It can prevent gut leakiness, which may reduce the risk of developing inflammatory bowel disease. Several studies reported a marked decrease in blood zinc levels of patients with intractable epilepsy. In one study, zinc therapy significantly reduced the frequency of seizures in 31% of the treated children. Scientists examined the potential of zinc supplementation to reduce seizure frequency in rats. In lab animals and test tubes, zinc deficiency was associated with a decline in thyroid function. In 134 disabled hypothyroid patients under anticonvulsant therapy, zinc supplementation was able to normalize the thyroid hormone levels in the blood and restore the thyroid function. A study on 25 children with Down syndrome suggested similar effects with the zinc supplementation. Zinc supplementation was also able to reverse the damaging effects of computer monitor emitted radiation on the thyroid hormone level of computer workers. Mucositis, ulceration of the mucous membrane, is a common side effect of chemotherapy and radiotherapy. Studies in patients who underwent chemotherapy and radiotherapy found that zinc supplementation was able to reduce the severity of the oral mucositis. Dysgeusia, or distortion of taste, and dysomia, a distortion of smell, can also occur during chemotherapy. A study found a daily intake of 100 milligrams of zinc for 4 to 6 months improved the dysgeusia and dysomia in the patients with carbonic anhydrase 6 deficiency. Zinc can stimulate the production of carbonic anhydrase 6, an enzyme in the saliva that's involved in taste bud growth. In a study on 79 autistic children, the severity of the symptoms like awareness, hyperactivity, receptive language, focus and attention, eye contact, sound sensitivity, tactile sensitivity, and seizures decreased after zinc and B6 supplementation. The children had high copper levels which reduced upon the supplementation. Prenatal zinc treatment prevented autism-like behaviors, like induced social deficits, repetitive behaviors, and cognitive inflexibility in rat offspring, indicating a possible link between its deficiency and autism development. In one study on adult mice, scientists observed the potential of zinc supplementation to prevent the development of autism-related behavior. Metabolic syndrome is a cluster of conditions like obesity, insulin resistance, high blood pressure, and high cholesterol. This can increase the risk of heart disease and type 2 diabetes. A study in 60 children with metabolic syndrome found zinc supplementation decreased insulin resistance, oxidative stress, inflammation, blood sugar, cholesterol, and body mass index. Women and children with higher blood zinc concentrations have better sleep quality, according to some researchers. 2 studies in infants revealed that zinc supplementation was able to prolong sleep duration. However, 1/3 of the children had stunted growth and were likely zinc deficient. Opioid users exhibit lower levels of zinc. Studies in mice and rats found that zinc reduced the dependency and the intensity on morphine, an opioid, while zinc chelators intensified withdrawal symptoms. A study in 10 wrestlers found that heavy exercise can significantly deplete thyroid hormones and testosterone levels, and this can lead to exhaustion. However, zinc supplementation was able to prevent the loss and benefit the athletic performance. In animal studies and test tubes, researchers have been investigating the potential benefits of zinc for bacterial infections, transplant rejection and autoimmunity, radioprotection, and pain relief. For more information, you can check out my video on the brain-boosting benefits of zinc. And for information on herbs, supplements, and natural treatment plans, check out my website.